The American Hospital Association's Distinguished Service Award recognizes a lifetime of achievement in healthcare leadership. This year, we honor Bill Petasnick, whose passion for patients, health policy, and healthy communities has touched us all. In 1993, Bill took the helm of Freighter Memorial Lutheran, a small community hospital in Milwaukee.
Freighter Hospital was a very small hospital, teaching hospital, but attached to Milwaukee County Hospital, very big county-run hospital. And one of Bill's big crowning achievements in Milwaukee was to acquire Milwaukee County Hospital. This little freighter acquires Milwaukee County Hospital. And from there, he built a nationally recognized academic medical center. And when you think about that, that's a fantastic gift to our community, to be able to have this wonderful, patient-focused, clinically excellent academic medical center right here in Milwaukee, and Bill did that.
Bill is an extraordinarily competent executive. Running big teaching hospitals is a great challenge for all of us because you not only have to deal with the size and complexity and the specialty nature of the organizations, but you also have to be part of the academic mission, the teaching and research that goes along with being an academic medical center. In that regard, those organizations tend to have even larger commitments to indigent care and serving larger, more geographically diverse populations.
At Bill's core is his conviction to serve. And in Milwaukee, he also brought competitors together to form the Milwaukee Healthcare Partnership to improve access for the city's vulnerable population.
It was in 2007 when Bill approached me and asked if I would be interested in working with him and his fellow CEO colleagues here in Milwaukee to look at putting together a public-private partnership that would improve health care for low-income, underserved populations. And at that time, there were a lot of challenges to access and coverage, as well as a lot of well-meaning efforts going on, but they were fragmented, and he recognized that no one health system could really address these issues alone. So he encouraged himself and his colleagues to park their competitive juices and to come together to look at creating a consortium.
Bill has also given his time and talents to the association. He was instrumental in shaping AHA policy on delivery system reform. As chair of our 2008 Board of Trustees, he led the association as we developed a national framework for healthcare reform. While Bill is retired, he remains active with the AHA, serving as chair of Health Forum.
Bill has had a tremendous impact on the field. When I hear him talk, it appears to me that the thing that he's most proud of is his time with the AHA. And that was a very critical time with the Accountable Care Act, and he was very engaged. Bill is a product of the 60s, so what motivates him is his desire to do good things for people. He always does the right thing, and he is very committed to doing what makes people's lives better.
As a grandparent, my dad spoils the heck out of my kids. They'll come into the city with him, and my kids get very excited because they know Grandma and Grandpa will get a slushie for them, get the donut, things like that. So, yeah, he's a great grandfather. I think the biggest lesson my father taught us was just to be a good human being, to be kind and be humble, to help others. I think he raised us to be good stewards of the community and just be good people. And hopefully that's what he sees when he looks at us, is that he's raised us well. I think he'd be proud.
At a young age, I learned the appreciation of giving back to your community and helping those that are not as lucky as you might be. And so, like my brother said, he always gave back to his community, whether it was his time, whatever it possibly was. He instilled in us, though, that no matter who you are, whether you are the mayor of the town, the president of the hospital, a teacher in the community, you give back and you help others. And that goes back to what my brother was saying, is just being a kind individual who didn't care about him, who still to this day doesn't care about himself as much as he does about others.
So much of what we accomplish is built upon the people that work with us. And I keep telling my students, this is not a game of golf where we each do our own thing and add up the score in terms of who wins. It's built upon the strength of the team. I've worked with some great people, great teams, and a great pleasure in terms of the core accomplishments that we were able to achieve. I coined the phrase, focus on the main thing. And the main thing is the focus on our patients. We're now dealing with incredibly complex organizations. And I've always felt we needed an anchor to come back to. And that anchor is our focus on patient care. For me, it was a driving part of our strategic strategies is how are we improving the lives of people. Always coming back and reminding people that, yeah, we run a business, but it's really the focus on the patient that makes the difference.
Bill, you've been a role model and mentor to so many in the field, and that includes me. It's reflected in your dedication and commitment to patients and communities. Congratulations, Bill, and thank you for your lasting contributions to the field.